Good morning and welcome. I'm Alice Rivlin. I have two claims to fame this morning. One is I have diabetes, and well under control. And the other is that I'm the director of the Health Policy Center at the Brookings Institution. And I would like to welcome you to what promises to be a very interesting morning. I welcome you on behalf of the Brookings Institution and the Health Policy Center and the Economic Studies Division. Our subject today is disruptive innovations in diabetes care from around the world, lessons for healthcare reform in the United States. We're sort of arrogant in the United States. Sometimes we think we can't learn much from the rest of the world. Actually, we can learn an awful lot. Much of the rest of the world, in part because they have less resources, are doing things that we're just sort of getting around to doing. So this is a moment of sharing information across very widely dispersed borders. And I want to thank our speakers who have, in some cases, traveled from a great distance to be here. Before we get started, a few brief housekeeping announcements. We are videotaping this event today and broadcasting it on a live webcast. And we understand we have quite a significant audience out there. So speakers, the people you're speaking to, are not all visible. A full recording will be available on our events page within a few days. And to ensure the quality of the recording, we'd like to remind you to turn off your cell phones and please get your questions ready for our Q&A sessions. And those of you who are joining us in the room, we will get you a microphone so that you will be well recorded. Those of you who are joining us virtually, we would invite you to participate by sending your questions using the hashtag @GlobalHealth. We will also have a timekeeper in the front row, and she's going to keep us all on time. With that, I have the pleasure of introducing Robin Osborne of the Commonwealth Fund to open our event. I'd like to thank Robin for being here, and also to help to thank the Commonwealth Fund, not just for their support of this event, but for leadership around the world in improving the health system. Robin is a vice president and director of the Commonwealth Fund's International Program for Health Policy. She has responsibility for the fund's annual international symposium on health policy. In addition, she serves on the editorial board of Health Systems in Transition. And it's my great pleasure to welcome Robin to give us a little more overview of the day. Thank you.
Thanks very much, Alice, for that kind introduction. Good morning, and it's a great privilege to be here with you today. And I just have to say, I am thrilled to see the portfolio of work that's on today's program. On behalf of the Commonwealth Fund, our tremendous thanks to Mark McClellan for his visionary thinking about health reform and accountable care organizations as a way of transforming our healthcare system. to all of our country's speakers for sharing their experiences with us today, and to our U.S. health system leaders for helping us crosswalk the lessons learned globally to our efforts here at home. Many of you know the Commonwealth Fund. We're a private foundation established in 1918 with the mission of supporting a high-performing healthcare system that expands access to care, improves quality of care, and achieves greater efficiency. We're particularly concerned about and passionate about improving care for the elderly, for low-income and uninsured people, minority Americans, and children. Integral to our work is an international perspective, and our international program in health policy and practice innovations aims to spark creative health policy thinking and exchange across countries, and to build the evidence base through cross-national comparative research, patient and physician surveys, benchmarking health system performance, deep dive case studies to understand what works and what doesn't across countries. And while every country healthcare system has a unique historical and political context, and they may be financed and organized differently, they are all being driven to get value for money. And there's a striking convergence in their goals. For the United States, that theme, value for money, resonates. We spend more on healthcare than any other country. As the fund's president, David Blumenthal, says, if there was an Olympics for healthcare spending, the U.S. would sweep the gold, silver, and bronze medals. But we generally don't get the best outcomes and often rank at the bottom, certainly in the fund surveys, when compared to 11 other industrialized countries. And while we have some of the best healthcare in the world, and you'll hear from some outstanding and world-class U.S. health systems today, on average, cross-national data shows room for improvement. We're hopeful that with the ACA and the delivery system and payment reforms it supports, we'll start to see some of the gaps in performance close. And we already have, as for example, through financial penalties, which have helped drive a reduction in hospital readmission rates. Since 1998, the fund has held an annual international symposium in Washington, bringing together health ministers and senior government officials from 11 countries around a theme. This past year, it was achieving a high-performing healthcare system for high-need, high-cost patients. For the first 5 or 10 years that we did this, when health ministers outlined their challenges their systems faces and their policy agendas, even though they all spoke English, it was as if each was speaking a different language. The problems, the strategies, even the words they used had there's little commonality. What's now striking, stunningly so, is the amount of convergence, particularly as we focus this year on high-need, high-cost patients, often frail elderly with multiple chronic conditions, the patients that we'll be hearing about today. This year, health ministers shared a very common vision for their healthcare system. They were all aiming towards an integrated healthcare delivery system that provides high quality, seamless, coordinated care for chronically ill patients, that empowers and supports patients and their caregivers, where information follows the patients between providers across sites of care, and a system that is innovative and using data and performance feedback to continually improve. They not only shared a common vision, but they also shared strategies that sounded remarkably similar. And it sounded like they were all pretty much using the same toolbox. Patient-centered medical homes, bundled payments, risk-sharing arrangements among payers and providers, payment based on quality metrics, not volume. But what's so interesting is that because each system is different, how they use those tools, and how each system implements these kinds of transformative changes is different. And that's why today is so incredibly timely and exciting to have the opportunity to hear about the different country models, how they work, and to learn from each other's experience in real time. So again, many thanks to our distinguished panels, Brookings Institution and the Merkin Family Foundation, for their sponsorship and collaboration, and for today's wonderful program.